Welcome to the revolutionary FITT diabetic foot ulcer treatment demonstration video. Before you start the treatment, make sure you have all the necessary equipment: disposable sleeve, sterile sponge, adhesive bandage, water-based gel, pair of scissors. Of course, you will need the pressure sleeves as well. Now, let's connect all the equipment to the control unit. First, connect the pressure sleeves. Connect the secondary sleeve, used on the leg not in treatment, to the secondary sleeve tubing receptacle. Connect the primary sleeve, used for treatment, to the primary sleeve tubing receptacle. Now, connect the disposable sleeve to the sleeve oxygen supply receptacle and power up the control unit. The sleeve tube, the primary pressure sleeve tube, and the secondary pressure sleeve tube plugs must lock into place when connected correctly. Now, prepare the patient. Remove the dressing from the patient's leg and foot being treated. Wash the wound. Remove any remaining ointment. Moisten the patient's foot. Remove the sterile sponge from its packaging and place the sponge on top of the wound. Affix it gently with the adhesive bandage. Use the scissors to cut the remaining bandage. Note that the disposable sleeve has an air shaft on one side. Make sure you place it on top of the sponge. Pull the disposable sleeve on the treated foot and leg. Make sure that the sleeve reaches all the way up the patient's calf. Verify that the air shaft is on top of the sponge. Apply a generous amount of gel between the top of the disposable sleeve and the patient's leg. Apply gentle pressure to ensure an airtight seal between the sleeve and the patient's leg. Open the zippers on the pressure sleeves and place the sleeves on both patients' legs. Position the sleeves so that the patient's ankle is aligned with the fold of the sleeve. Be careful when closing the zipper to ensure it does not compromise the integrity of the disposable sleeve by pinching or puncturing it. With everything now ready, press the power on/off button on the control unit and tap Start on the touchscreen to start the treatment. Monitor the sleeves to make sure they inflate. First, the system activates its negative-positive compression. Then, the area is treated with an oxygen and ozone mixture. When a treatment ended message appears on the screen, remove the pressure sleeves, cut open the disposable sleeve, cut open the bandage, and dispose of the sponge, bandage, and disposable sleeve, according to your facility protocols for biohazardous waste. Treat the wound according to standard hospital protocols. Now, watch a better healing process take place. FITT, for better diabetic foot ulcer treatment.